Hi, my name is Anat Lankri. I graduated from La Trobe University last year and I am currently the new graduate at Royal Darwin Hospital in the Northern Territory. I work in a department of 6 speech pathologists in the acute part of the hospital and I have an acute caseload mostly of general medical, neuro and GEM patients. Typical day for us starts at 8 AM. We get into work, have a coffee, catch up. Then we have a board meeting, discuss any new referrals we might have and prioritise patients for the day. Then we go down to the wards and see any new strokes that came in overnight. And sometimes we have a multidisciplinary team meeting for the wards, which usually goes for about an hour. Then we have morning tea, review some more patients, any new referrals or patients that need to be reviewed. And then it's time for lunch on the wards when we do some swallow assessments, and then we have our own lunch. In the afternoon we do any more patient reviews and paperwork, do our stats, discharge summaries, write reports and any paperwork. And we finish work in the Northern Territory at 4:21. I'm from Melbourne, so moving away from home, it was definitely a challenge, but it's been a really positive experience. Working in a rural or remote area can be really great. You tend to have a really great community of people because everyone moves from another place. Everyone tends to be really friendly and accommodating, which makes the workplace a really nice environment. It's important to have a supportive department and team to work in. Full-time work can be really overwhelming and exhausting, and living away from home can make it that much harder. So things to remember: be aware that your learning only really begins once you leave university and get a job. You're expected to ask questions and not know things. Learn from others, your colleagues, doctors, nurses, allied health, as much as possible. Take opportunities to observe others and let them observe you as well. Also remember, things aren't always as they appear in a textbook. So patients often don't fit a certain type of aphasia. Their signs and symptoms don't necessarily fit a certain diagnosis. It's important to be holistic and look outside the box in order to provide patient-centred care. For example, I work with a large Indigenous population and I've done a swallow assessment using turtle before. What can be helpful? Acknowledging my limitations. This was probably one of the most important things for me to learn. You can't know everything, especially when you're working in a major hospital. It's really easy to get overwhelmed with all of the medical jargon, but remember to learn and acknowledge what you need to know for your job, and don't become overwhelmed with all of the medical jargon you don't need to know. The rest will come with experience. Use your supervision sessions well and don't be afraid to ask clinicians for help. That's often the best way to learn. It's also really important to try to find a balance between clinical and non-clinical time and work and life balance. Good luck and congratulations.